During this year's celebration of Women's History Month, Queens Public Library is celebrating the leadership, strength, and solidarity of women identifying individuals in all walks of life. Be inspired to unleash your power within and make your visions for the future a reality. For upcoming programs, book recommendations, and more, visit queenslib.org/WHM 2023. Tax season is here. Queens Public Library is partnering with a number of organizations to offer free in-person tax counseling sessions at several QPL locations. Visit our blog at queenslibrary.org for more information. QPL's mobile app now translates to over 90 languages. Check out all the services you can access using our mobile app and its latest features. It's available for both Apple iOS and Android. Download the QPL mobile app today at connect.queenslibrary.org.
Welcome to Wellness Wednesdays. I'm Christopher Galarza, Queens Public Library's Community Health Coordinator. Today, we are joined by Melissa Centellis. Melissa is an adult sexuality educator with Planned Parenthood of Greater New York. Planned Parenthood of Greater New York's vision is to build a world where all communities have full access to innovative, high-quality, affordable, evidence-based sexual and reproductive health services, with a mission to be a fierce advocate and a committed partner to advance equity and improve health outcomes for all. This session of Wellness Wednesdays is about sexual health and may not be suitable for children or those who are sensitive to these topics. Please use your own discretion while viewing or participating in this program. There will be clinically correct anatomical illustrations of both the male and female reproductive systems to help us identify each part of our bodies and how to properly screen for different cancers. If you would not like to see these illustrations or are in a space where you feel it may not be appropriate, you can always join us live at our next program. As always, if you have any questions or want to comment on anything that we're talking about, please drop those in the chat, as we always love hearing from you. And without further ado, Melissa, please take it away.
Thank you, Christopher. Hi, everyone. That was a great introduction. I'm super excited to be here. As Christopher said, I'm Melissa. I'm an adult sexuality educator with Planned Parenthood of Greater New York. And today's workshop is going to be about taking care of your sexual wellness. So we can move to the next slide. Oh, there we go. All right. So our agenda for today is we are going to do introductions. I know we're on a virtual platform, but for me, it's always helpful to know who's in the space. And then we're going to be talking about some sexual wellness services, some that are available at Planned Parenthood and some that are not. However, all of these services are things that are super important. And if we're wanting to take care of our sexual health, it's information that we should be aware of. I often tell people, even if we're on a slide where we feel like I don't have that body part, I don't think this is something that I can utilize. We are all vessels of information. We know people who may need this information. So just soaking in that knowledge. So after going over a few services, we are going to be doing a sexual wellness appointment walkthrough. So talking about when you come into a Planned Parenthood, or even if you go to see your own healthcare provider, some questions that may come up depending on the type of visit that you are coming in for. Then we'll wrap up by talking about a few other Planned Parenthood of Greater New York health services, and then we'll close out and everyone can enjoy their Wednesday. So I know that folks can utilize the chat. You can feel free to share your name or your pronouns. Some examples are she, her, or they, them. And pronouns are just a way in which someone would like to be referred to if you're in this space or not in this space. My pronouns, I'm Melissa, she, her. So if I'm not in the room, if I am in the room, if someone can refer to me using the correct pronouns. And then if we're comfortable, we can also share something that we wear that makes you feel like your best self. For this question, I always say my glasses. I have a few different frames, so depending on the day, the vibe, what's going on, I may change to a cat eye lens, or I may keep my regular glasses on. So as we continue through today's workshop, please feel free to utilize the chat and share something about, what makes you feel like your best self. All right. So before we dive into the workshop, we are going to be in this space for about an hour. And so anytime I facilitate, I have some group agreements just to make sure that we're comfortable and that we're soaking in the information that we're learning. And so the first group agreement is to be present. This looks different for different people. Having note-taking material, having something to drink, having a snack, whatever we need in the moment to make sure that we are, have our eyes on the screen and we're paying attention. The next is privacy or using I statements. So as a facilitator, it's always helpful when people share in the chat, maybe knowing about a service or, coming into a Planned Parenthood or knowing someone that's come in to a Planned Parenthood. However, keeping things in the eye and also, recognizing that we are on an online platform. We don't want to share anyone's information. So just remaining private with the things that we do choose to share. There's going to be moments where I'm going to say, put things in the chat. If you have any comments, feel free to write them down. There's always the right to pass. Sometimes we're just taking things in and questions or comments may come up later on. And then lastly, staying on track. There's a lot of important information that we are getting through. So just making sure that we are running through all of the information and being conscious of time. So those are the group agreements for today. And we're going to start our conversation on sexual wellness. So here on the screen, we have our friend Danny. Danny is a stick figure in blue in the middle. Danny is smiling. Danny is having a great Wellness Wednesday. But Danny is our friend, and they are interested in taking care of their health. And with this slide, I often tell people, of course, we're talking about sexual health, but health overall, right? So what are some things that Danny or advice that we could give to Danny in regards to taking care of their health? And so we see some images that are surrounding Danny that kind of give us a little bit of a hint of some advice or things that Danny should do in order to make sure that they're healthy and that they're taking care of themselves. So just to talk through some of these images, the first is maybe making sure that we have support, right? Whether it's emotional support, mental support, talking to our peers, our friends, our family, having people in our lives that we feel like when things are going on, we can talk to them, right? Or they can help us with resources or information to getting the help that we need. So making sure that we're maintaining healthy and positive relationships with partners, friends, family, and even peers. Next, we have an image of what looks to be like an apple and maybe a bottle of water. And I always tell people, I'm not saying that you have to eat a million, billion, trillion apples to be the healthiest version of yourself. However, making sure that we are nourishing our bodies, right? If we are hungry, if we're thirsty, we're hydrating our bodies, and we're making sure that we are eating a balanced diet. Also going to a healthcare provider. And we'll talk about this a little bit more as we walk through some of the services, but oftentimes we tend to go to the doctor when something's off, when something's wrong, when we're not feeling 100%. And I think it's important when we're thinking about, of course, our sexual wellness, but of course, our health overall, that we should make sure we're going to the doctor, even if things are completely okay, right? Just to create that part of our routine to make sure that we're always seeing our healthcare providers if it's accessible to us. And then lastly, some sort of physical activity if we're able, right? Not saying that we have to lift weights, but taking a walk outside or doing yoga, some of our, favorite physical activities, if it's dancing, making sure that we're moving around if possible. So these are a few things that we can give advice to Danny on, making sure that they have access to some of these things. But also when I do this presentation, folks will also share like journaling, praying, meditating, things along that line as well to make sure that Danny is as healthy as they can be. All right. So now we are going to dive into the next section, which is talking about sexual wellness. I just want to reiterate what Christopher said earlier. In the next slide, we are going to be seeing some pictures of anatomy of the internal reproductive organs. We're not going to spend too long on these slides. However, throughout today's workshop, I am going to be referencing these body parts. I will say for someone with a vagina, for someone with a penis. And so just want to make sure that we have a clear understanding of the body parts that we are referencing. You will also hear me say, for someone with the vagina, for someone with the penis, because we want to make sure that we are being inclusive of all gender expressions and identities. Not everyone that has a penis identifies as a man or a male, and not everyone with a vagina is someone who identifies as a woman or as a female. So just being conscious of those things as we move into the next slide. So here we are seeing on the screen the uterus, the cervix, the vagina, and then we are also seeing the internal reproductive organs of someone with a penis. So once again, just noting, some of the things that we are going to be talking about, knowing where some of these body parts are as we move forward and talk about some of these services. All right, so we're going to dive into talking about some services. And the first service we have on the screen is birth control. So more specifically, we are seeing a birth control pill. However, while we're not going to talk about all the birth control methods that are available, we are going to be talking about a few. So with birth control, most commonly, and I think a part of that is because of the name, people may choose to utilize birth control to prevent a pregnancy from happening. But there are numerous reasons why someone would choose to use birth control, or more specifically, a hormonal form of birth control. Sometimes this helps with weight gain or weight loss. It can even help with acne. And for individuals who are receiving a period monthly, alleviating some of the discomfort or pain that they get from their period. But of course, with the name, most commonly, people generally tend to utilize birth control to maybe prevent a pregnancy from happening. Now, with birth control, there are two forms that we are going to talk about a bit more. I'm going to share some fun facts, and then we'll move to the next slide. So while we did talk about briefly, birth control working to prevent a pregnancy from happening, forms of birth control, specifically barrier methods, which are known as condoms, also help prevent against a sexually transmitted infection. And we'll talk about STIs later on in today's workshop. But something to be conscious of is while someone may be utilizing a birth control pill or maybe an IUD, or also known as an intrauterine device, which is placed inside of the vagina to prevent pregnancy, these methods do not prevent a transmission or contracting a sexually transmitted infection. And that's where barrier methods come in. So I have two different condoms. I have let's see if it'll pop up. We have an external condom, or this is also known as a male condom. And then we have here a internal condom, or also known as a female condom. And so these are barrier methods. A lot of times when I facilitate, people are more familiar with seeing the condom that is placed on a penis. However, condoms that can be placed inside a vagina are also available. When we go into pharmacies, when we go into stores, I tend to not see them. However, they are available at a lot of different community health centers, at Planned Parenthood. And so if someone is having sex, there's a lot of different reasons as to why they may choose to use a internal condom or an external condom, right? For someone who would choose to utilize a female condom or an internal condom, one thing to note, and I can actually open it up so folks can see a visual. So this is what the female condom looks like, right? And so here we're able to see there's kind of this ring. And so someone with a vagina can twist this ring slightly. They can pinch it, and this will be inserted inside of the vagina, and this will lay on the outside of the vagina. So for someone who chooses to use an internal condom, part of it may be because of pleasure. This is laying on the outside of the vagina, and during penetrative sex can hit the clitoris, which may be more pleasurable for someone. Another fun fact about using the female condom is it actually can be placed upwards of 3 to 4 hours before intimacy happens. And so that may also be a reason, right? People have busy schedules. They know that they maybe have a date or something that's going to happen at 5 o'clock. And at 3 o'clock, they can insert the condom and already be ready for intimacy to happen. So while this is a condom that is commonly used for people with vaginas, we use the term female condom and internal condom interchangeably because this inside ring can be removed. So we'll take this out. And so with the ring that's now removed, this condom can be placed inside of the anus. So regardless of whether or not someone has a vagina or not, if they are having anal sex, this can be used for anal sex as well. So that's a little bit about the female or the internal condom. And we also have the male or the external condom, which is commonly placed on people who have a penis, right? So whether we are using a female condom or a male condom, internal condom or external condom, when we are opening condoms, we want to make sure that we are checking for air. So pressing down on the condom. If we're not hearing any air in the package, there is a chance that maybe there's a hole in the condom, there's a tear. And so we need to take a step back, turn the lights on, and examine the condom, right? So we check for air. The next thing we want to do is check the expiration date, make sure that it is not an expired condom. And once we've checked those two things, tearing the condom open with our hands, oftentimes in media, in movies, in shows, people are ripping the condom open with their teeth. They're having a moment of intimacy. Things are hot, things are intense, but we want to make sure that we are opening with our hands. We're not using any scissors, not pressing with a pen or anything, so that we can make sure it's being opened properly. So just to reiterate, both condoms are available at Planned Parenthood. You can walk in, they're completely free. Oftentimes, a lot of Planned Parenthoods will have a big kind of like bin or box of condoms, and you can come in and grab a few. However, people can put in the chat other places where condoms may be available for purchase or for free. Sometimes libraries have condoms. Schools and universities, their health centers tend to often have condoms as well. Guidance counselors may have them in their office. So there's definitely a few different places where folks can go in and get access to a condom. All right, so I'm gonna go to the next slide. And the next service we are going to talk about is transgender hormone therapy. This is also known or referred to as gender affirming hormone therapy. And so for folks that are interested in utilizing this is a service that is offered at Planned Parenthood. And so within this service, hormones are going to be prescribed to transgender people. And so these hormones work to make the body more feminine or more masculine. So just to step back for a second, so for someone who is transgender, their gender identity may not match their gender expression. So their gender identity being how they identify, whether male or female or non-binary, so not fitting into a particular or not affirming to a particular gender. And so someone who is interested in utilizing transgender hormone therapy or gender affirming care may be interested in having their gender identity match their gender expression. So, appearing more masculine or more feminine visually. And so they can come into a Planned Parenthood and meet with one of our healthcare providers to discuss possibly utilizing this service and what other kinds of services feels right for them. So, although this is a hormone therapy that's provided, under gender affirming care, there's other services that someone may choose to utilize. And so this isn't a service that everyone wants. And we can talk about what feels comfortable and what works best. So, on the theme of hormone therapy, we also have menopausal hormone therapy. So, for menopause, this is when, for someone with a vagina, every month they receive a period. They receive, like, it's a gift. But their body is essentially prepping for pregnancy. When pregnancy does not happen, their uterus lining is shedding. So, the uterus is prepping for pregnancy to happen. When it does not happen, it says, oh, there's nothing going on. So the uterus lining sheds, and that is why someone bleeds monthly on their period. A period can happen 3 to 5 days, maybe a week for some individuals. And so after a particular age, a period no longer happens. And for someone with a vagina, they are hitting menopause. So with menopause, a lot of different things are happening to someone's body, right? Someone was used to getting a period monthly, it's no longer happening, so their body is adjusting. People who go through menopause often experience sleep problems, maybe vaginal dryness, and even hot flashes. And so, to alleviate some of the symptoms that they are experiencing from menopause, there is menopausal hormone therapy. So, this is estrogen that is given to the individual to kind of help with some of the sleep problems or back pain and hot flashes that they are having. This is also a service that is available at Planned Parenthood. And if folks are interested, they can always come in to speak with a provider to discuss possibly utilizing menopausal hormone therapy or other ways to adjust as their body goes through menopause. All right. So the next service is a chest exam. So during a clinical breast or chest exam, a healthcare provider is going to have gloves on and they're going to check the surrounding areas of someone's chest. They're going to be checking the nipple, the breast, even upwards near the armpit. And they're going to be checking for any lumps or bumps that could possibly be cancer. We are going to watch a short video that talks about doing a self breast exam, and then we'll talk about this service a bit more.
You can check your breasts by standing in front of the mirror, lying down, or getting changed. Use the flats of your fingers to check over the whole of the breast. I personally use a circular motion around the whole breast to check out for any lumps or thickening tissue. Use different levels of pressure, but do not press too hard or squeeze. Once you have checked your whole breast from your collarbone to your ribcage, make sure you switch to the other side and repeat. So now you've checked your breasts, you need to check your armpits in a very similar way with circular motions checking for any lumps at all. Gently squeeze the nipple of each breast using your thumb and index finger, and you're looking out for any fluid or discharge leaving the nipple. There is no right or wrong way to check your breasts. If in doubt, see your GP.
All right, so One thing I want to uplift again that was shared in the video is that there's no wrong or right way to check your breast or your chest when you are doing it at home yourself, right? I always tell people we know our bodies the best, we advocate for our bodies. Maybe we are taking a shower, we're getting dressed, we're putting a shirt on, and we notice something or we feel something that is not normally there. And this kind of goes back to the point that we made earlier, which is making sure that we're going to the doctor even when things are completely okay. However, not waiting until something is wrong. So if we notice maybe discharge that never really comes out of our nipple, or we're feeling a slight bump or lump that usually is not there, not to say, oh my gosh, this is an indicator of some type of cancer. However, we're noticing something, we definitely should take the initiative of seeing a healthcare provider just to get it checked out. So we do offer chest exams at Planned Parenthood. However, if a chest exam was to happen, a lump or a bump is found, the provider may suggest additional testing, which may lead to a mammogram, which is an x-ray of the actual breast or chest. We currently do not offer mammograms at Planned Parenthood. However, we always refer out. So if someone does come in, they receive this exam and they need additional testing, we can always connect them to other community resources and healthcare providers that can provide that service to make sure that everything is a-okay. All right. So the next image of what we're seeing on the screen is a Pap test and a pelvic exam. Here on the screen, we are seeing an image of someone with a vagina. They are laying on a lab table, and inserted inside of them is a speculum. So starting with a pelvic exam, this is where a healthcare provider is going to insert 1 or 2 lubricated gloved fingers into the vagina. And at the same time, they are going to be pressing on the pelvic area or like the lower part of the stomach. They are doing this to check the top of the uterus to make sure, check the size and the shape and the position of the uterus as well as the ovaries. So while a pelvic exam is being done, a Pap test usually happens as well. And so that's where the speculum, or what we are seeing inserted inside of the vagina, comes in. So a Pap test is checking for any changes on the cervix that could possibly be cervical cancer. The speculum is going to be inserted inside. It's going to be opened up slightly so that a healthcare provider can see someone's cervical walls. And so they're going to take kind of like a really long Q-tip, and they're going to swab the cervical walls. They're going to remove the swab, remove the speculum, and send that oversized Q-tip to a lab just to check to see if cervical cancer is possibly occurring or if everything is fine. So one thing to note, or a fun fact about getting a Pap test, is while they are checking for cervical cancer, you can also ask for a sexually transmitted infection test as well. Some healthcare providers will let you know that you can do both at the same time. Some healthcare providers will not. So just a fun fact and something to be aware of. You can get two exams done in one appointment. So for people with a vagina, a Pap and a pelvic exam generally starts around the age of 21. People will often ask me, well, I'm not sexually active, so do I need to get a Pap test? Regardless of whether or not you are sexually active, the Pap test is checking for cervical cancer. So this is an exam that we encourage individuals to receive, and this is an exam and a service that is available at Planned Parenthood. So in the next slide, we have a short video that's going to detail more information about the speculum, and then we'll wrap up with this service.
Okay, so if we pretend that my fingers here are the opening to your vagina, in a speculum exam, we'll take the speculum, place it into the vagina, and then we'll open it. With the plastic speculums, they make a clicking noise like that. Don't let that surprise you. Sometimes that's kind of unexpected. So with the speculum open, Your care provider can now see your vaginal walls as well as your cervix, which will be right down here on this side. And if you need a Pap test, that's what they'll swab the cells on your cervix to send into the lab. After your care provider takes a look, they'll close the speculum and take it out.
Thank you. All right, so as we were seeing in the slide or in the video, that is most likely what is going to happen during a Pap exam. A little fun fact also about going in for a Pap test. So when I facilitate, a lot of people will share, I've had a Pap exam done. It was very painful. It was uncomfortable. And I don't think I want to get it done again. Part of where the discomfort or the pain may be coming from could be because of the size of the speculum. When I started this work, that was something new that I was able to learn. So you can actually ask your healthcare provider for a smaller size speculum, and that may alleviate some of the discomfort that you feel. I want to uplift that a Pap test should not be excruciatingly painful. And if folks have had that experience before, talking with their healthcare provider so that they can walk you through the exam. And also so they can take their time during the exam. You can know exactly what's going on, and you can pause if you are feeling any sort of pain or discomfort. So the next exam that we are going to talk about is a prostate exam. So here what we are seeing on the screen is a healthcare provider is inserting a lubricated gloved finger into someone's rectum. And that oval shaped kind of reddish purplish circle that we are seeing, that is the prostate. So generally a prostate exam happens or is recommended for people with penises or men over the age of 40. Depending on someone's healthcare history, their family history, they may have to receive this exam a bit earlier. And so a prostate exam, once again, is checking the prostate. And you're going to hear me say lumps and bumps a lot, but a lot of these exams are checking for lumps or bumps that could be an indicator of either cancer or something else that's going on. So once again, depending on someone's family history, this exam may have to happen earlier than the age of 40, but generally around the age of 40 is when this exam is done. This is not a service that we offer at Planned Parenthood. However, we still encourage folks to find information and find resources around getting a prostate exam done. People can still come into a Planned Parenthood, and if they are experiencing any discomfort with their penis or with their testicles, we can once again refer them out to receive this exam. Along with getting a prostate exam, there's also a testicular exam. And so during a testicular exam, a healthcare provider is going to touch someone's testes. And these are the two ball-like glands inside of the scrotum, so at the base of the penis. And they're going to be checking for anything unusual. So they are going to cup someone's testicles. Someone can also do a testicular exam at home. Once again, we're putting on pants, we're getting out the shower, we're taking a shower, maybe we're sitting down, we feel some discomfort, some pain, maybe our testicles are swollen. Not to say, oh my gosh, this is an indicator of cancer. However, it's something abnormal that we're noticing, and we can go in for a testicular exam. This is a service that we do offer at Planned Parenthood. And it is available regardless of someone's age for a testicular exam. If they're feeling some sort of pain, they can still come in and receive this service. The next service is pregnancy testing. So pregnancy tests, we can get them at a lot of different places. Planned Parenthood, Target, Walmart, Rite Aid, pharmacies. What we are seeing on the screen is a common take-home pregnancy test where we are seeing that sliver of pink, that's the cap. Someone would take the cap off. They would urinate on the stick. Usually they have to wait maybe 7 to 10 minutes. And 2 lines generally means pregnant. 1 line means not pregnant. So someone can come into Planned Parenthood for a pregnancy test. They can either draw blood or they can also urinate into a small little cup. And so if an unintended pregnancy happens, so someone was not looking to currently become pregnant or expand their family, there are a few different options that are available specifically at Planned Parenthood. So first, we have options counseling. So we do have some amazing counselors that are available that will speak to you about moving forward with the pregnancy if that's something you are interested in. So if you are choosing to parent and move forward with the pregnancy, or if you're interested in moving forward with the pregnancy and doing adoption, we do have resources and connections to support that decision. If someone is not interested in moving forward with the pregnancy, we also have abortion services. I know a lot was happening in the world the last few months. However, abortion is still someone's legal right here in New York. It's still an accessible service, so you can still come into a Planned Parenthood. You can still receive that service or speak to someone about possibly terminating a pregnancy. If someone does move forward with the pregnancy, we currently do not offer prenatal care. So prenatal care being throughout the duration of someone's pregnancy, having checkups, ultrasounds, taking vitamins to make sure that the baby and the pregnancy is developing in a healthy manner. We no longer provide prenatal care. However, once someone does receive a pregnancy test and is interested in moving forward with their pregnancy, we can connect and refer out to other healthcare clinics and providers who can support someone with providing prenatal care throughout the duration of their pregnancy. All right, so we're wrapping up on some of the services. Here on the screen, we are seeing emergency contraception. Other terms for emergency contraception, Plan B, the morning after pill. But here on the screen, we are seeing two different forms of emergency contraception. So the first that I want to talk about is the pill. So the morning after pill should be taken only in emergencies. And this is a pill that's taken if unprotected sex happens, or maybe someone was having protected sex, they were using a condom, and in the midst of intimacy, the condom breaks, and there is a chance that pregnancy could happen. So taking the pill, there's a time frame of about 3 to 5 days in which the pill should be taken in order to prevent a pregnancy from happening. An emergency contraception pill is not an abortion pill. So with emergency contraception, it is stopping pregnancy from even happening. And the way I like to explain this is, in order for pregnancy to happen, an egg has to be released through ovulation. With taking a form of emergency contraception, it's delaying ovulation from happening. So if there's no egg, there's no chance that pregnancy can happen. So while someone may have 3 to 5 days in order to take the pill, or we'll talk about the other form in a second, we always tell people the sooner the better. So we see the pill here on one side. On the other side, this is a copper IUD, or an intrauterine device that is placed inside of the vagina. So, fun fact, sperm does not like copper. I don't really know the science behind it. I don't know all the science behind it, but sperm is really scared of copper. So this is actually a non-hormonal method. The copper itself is what is stopping the sperm from meeting the egg. So the thing about utilizing the copper IUD as a form of emergency contraception is, like I said before, there's a particular time frame in which you need to have it placed, and an IUD has to be placed by a healthcare provider. Usually when we call the doctors, it may take a week and a half to maybe get in for an appointment. And so this may not be as accessible of a form of emergency contraception compared to the pill. However, if someone is able to call and within the time frame 3 to 5 days after having unprotected sex, if they are able to get an appointment, they can get the IUD placed. And the good thing about getting it placed is moving forward, you now have a form of birth control placed inside of you. So worrying about a potential pregnancy happening is alleviated. With the emergency contraception pill or the Plan B pill, a barrier may be price. So a Plan B pill oftentimes is also sold at Walmarts, Targets, at pharmacies, but they tend to be a bit pricey, anywhere from $40 to $50, which may not be accessible for everyone. So you can come into a Planned Parenthood and you don't have to have an appointment, and you can ask for an emergency contraception pill. We do charge, however, it will not be as much as $50, and you do not need an appointment. So just a fun fact for folks to have, we don't always have to go into a Rite Aid and spend that $50. There's other ways to get access to the Plan B pill. All right, so we're wrapping up with the last service, and this is sexually transmitted infection testing, or STI testing. So there are 3 different forms of getting tested for an STI. There's a urine exam, there's a swab, and then there is drawing blood. Depending on the type of infection that someone is testing for, a healthcare provider may suggest doing more than one test, or maybe just doing one. With testing for sexually transmitted infections, at Planned Parenthood, and this also goes actually for the PAP exam, we have something known as a self-swab, meaning that someone can swab themselves and, with the Q-tip that they swab themselves with, they can place it back into a baggie and give it to the healthcare provider, rather than having the healthcare provider swab them for the exam. There's a lot of different reasons why someone may choose to do a self-swab. For one, it can be really empowering knowing that you're advocating for yourself, you're coming in to do an exam to take care of your health. And rather than having the healthcare provider do it, you can do it for yourself. Unfortunately, people may have had really bad or really uncomfortable experiences with getting tested for a sexually transmitted infection previously, and so they may choose to do the self swab on their own. When it comes to testing for a sexually transmitted infection, we like to tell people at least once a year to know what's going on with their body, or before having sex with a new partner. People live different lifestyles, so whether it's 3 months or 6 months, at least making sure that we are getting tested once a year. I feel like I lost my train of thought. Oh, there's another fun fact that I wanted to say, but I can't remember. But this also ties into our conversation about birth control. Once again, although there are many hormonal methods of birth control that can prevent pregnancy, they do not prevent the transmission or possibly contracting a sexually transmitted infection. So also making sure that we are utilizing a barrier method if we are being intimate. Oh, now I remember the fun fact. The reason we want to make sure that we are getting tested, regardless of whether or not we have a new partner, at least doing it once a year, is that when it comes to sexually transmitted infections, most commonly, no symptoms tend to come up when it comes to STIs, right? And this ties back to going to the doctor when we feel like something's wrong. If we don't have a symptom of an STI, maybe we're urinating and we're not feeling any pain, we're not having any abnormal discharge, maybe our testicles are not swollen, we're living our best life. We may not know that something is going on and that we may need to be on an antibiotic or take medication for a possible infection. So if we don't have an indicator of an infection happening and maybe we're having unprotected sex, there's a chance that we are contracting or transmitting an infection. So making sure that we have that peace of mind, that we are getting tested at least once a year or prior to having a new intimate partner. All right, so those are some of the services. STI testing is available at Planned Parenthood. And now, speaking of Planned Parenthood, we are going to talk about your sexual wellness appointment walkthrough. So when you come into a Planned Parenthood, we do ask for photo ID. One thing I want to note here is that it does not have to be a government issued ID. As long it could be a school ID, as long as it could be as long as it has a picture of you and your name, and we can identify you. It's perfectly fine. We can use that ID. We are still following COVID guidelines, so we may ask you to still wear a mask, and we may also screen for any symptoms. So if you're having a fever or any symptoms around COVID, possibly rescheduling your appointment if it's possible. So after coming in, we do have medical interpretation available in your language, and this is available both in person or over the phone. So when you fill out paperwork, we can also have that paperwork in a different language, or we have our staff and our team members who can possibly translate for you, or we have a phone system that can interpret your visit in a language that feels most comfortable. So after filling out some paperwork, you are going to meet with a medical assistant who is going to ask some questions about your health, about your family's health, and your sex life. I always like to tell people, you may feel like, what is happening? Why are they asking about how many partners I've had, what type of sex I'm having, when's the last time I had sex, right? They may ask a lot of intense questions. All of this information is completely private. The medical assistant is just asking these questions to get a better idea of if there's additional testing that may be beneficial, or if there's a particular test that you may need. So after answering a few questions, depending on the exam that you come in for, you might be asked to change into a robe. So if you're coming in for a sexually transmitted infection test, you may just have to do a urine sample, and so you may not have to change into a robe for that. However, if you're doing a chest exam or a prostate or a testicular exam, a testicular exam, you may be asked to change into a robe. So after changing into a robe, a healthcare provider is going to perform the exam, and they should be telling you exactly what is going on, and exactly what they are doing. I always tell people, as a patient, I am like unbearable. I'm the type of a patient that's like, what is this? What's that? Can I touch this? What does this mean? Right? I try and ask all the questions. I'm nosy. I feel like I'm in there for an exam. I want to know what's happening, and I want to make sure that I'm advocating for myself. A lot of times we see healthcare providers, they're busy, and we may feel like, I don't know if I have time to ask a question, or, I just trust them to do what they need to do. But we definitely need to advocate for our bodies, right? We understand our bodies, we know our bodies the best. And if we feel like something is off, if we have a million questions, making sure that we are asking those questions. So after the exam is done, a follow-up call or visit may happen. One thing that I want to highlight here about Planned Parenthood is confidentiality. When you come into a Planned Parenthood, you can tell our receptionist, or even the healthcare provider, I'm coming in, but I would really appreciate if I do get a follow-up call, please do not call and say that you are from Planned Parenthood, or maybe I don't even want to get a call at all. We can send things to your email, or if there's a phone number that you prefer us to call, we can call that number. Along with calling, we can make the note of maybe not calling and saying, oh, hi, like this is Melissa from Planned Parenthood. I'm calling for so-and-so, right? We can just say, oh, hi, I'm Melissa. I'm so-and-so's friend, and I'm just calling to check in, right? And then once you get on the phone, we can share some information about what's going on with your visit, if you need to come back in, and if additional care is needed. So we hope this doesn't happen. However, we want folks to advocate for themselves if it does. So if you were to come in and have a negative experience with the healthcare provider, there are two different options that you can take. First is completing a patient experience survey to detail what happened during the exam. And then you can also file a complaint with the New York State Division of Human Rights to speak about the experience and what occurred. So just wrapping up on some of our services and some additional information for everyone to have. So some of these services we did talk about, some of them we did not. But this is a long list of different services that we provide at Planned Parenthood. So numerous birth control options, testicular exams, cancer screenings, emergency contraception, or also known as the morning after pill. We provide gynecological care, so this includes the PAP exam that we talked about. We also provide health insurance enrollment, which we're going to talk about in a second, HIV testing and counseling, medication and surgical abortion, menopausal hormone therapy, pregnancy testing and option counseling, PrEP and PEP. So this is pre-exposure prophylaxis and post-exposure prophylaxis. This is a medication that is given for those with HIV or who have possibly been exposed to HIV. We also have sexually transmitted infection testing and treatment. We spoke about transgender hormone therapy. We do provide vasectomies. So vasectomies, it's a form of birth control, a more permanent form of birth control for people with penises. And then we also do wellness exams. So once again, if there is maybe a service that is not here on the screen, but maybe we're coming in for an HIV test and we have additional questions about another service, you can always come in and we can always refer out to maybe a different health clinic that can provide the particular service that you are looking for. So this is a little bit about our telehealth services. So similar to how we are meeting now or on a computer screen, you can meet with a healthcare provider. So we have the phone number to call, which is 1-800-230-PLAN, or our Planned Parenthood of Greater New York website, which was placed in the comments earlier. Along with calling or going on the website, we also have a mobile unit. So the mobile unit, which is known as Project Street Beat, and the website link is also in the chat, may be closer to where someone is located. So Project Street Beat operates all throughout the boroughs. They're in Manhattan, they're in Staten Island, they're all over the place. They're this really huge van, and sometimes they may be parked closer to someone's school or their job rather than coming into to one of our brick and mortar locations. And so majority of the services that we offer in within our physical health centers are also offered on the mobile unit. So the mobile unit is completely free. You can come in and receive some of those services. I'll be sure to put my email in the chat at some point, just if folks have additional questions or maybe need support making an appointment, I can provide that support. We also have virtual office hours. I have an amazing colleague, Maria, who is one of our health promoters. And so they provide virtual assistant hours during Monday, Wednesday, and Friday from 10 to 12 and then 2 to 4. This is the phone number to call. If interested, you can speak to someone or speak to Maria. If you have questions about making an appointment or questions about, I went to an appointment and I'm not sure, if I got this checked out, I'd like to come back in. Maria can help and provide that support. So I spoke a little bit about health insurance enrollment. I just wanted to speak about the Family Planning Benefit Program. Before I was doing health education at Planned Parenthood, I was working with our family planning program. And so this is an insurance program that we have that's completely free and completely confidential. One thing to note about coming into Planned Parenthood is you can have insurance, you can not have insurance, or you can be underinsured, meaning that you have an insurance, but maybe it doesn't cover a particular birth control method that you want or a particular service that you're interested in gaining access to. So with the Family Planning Benefit Program, there's a few eligibility requirements to access the insurance program. So being a New York State resident, being a US citizen or lawfully present. You have to meet particular income guidelines, and then you have to be within reproductive years. Um, Although this is a program that we offer, this isn't like one and done. If you meet the requirements, that's, this is a program that's accessible to you. If not, still come into a Planned Parenthood. We, like, regardless of your ability to pay, your immigration status, you can still come into a Planned Parenthood and receive care and receive the services that you need or that you're interested in gaining access to. This is just one form of, making our services accessible that we utilize. My email is here on the screen as well, but I think it's also been placed in the chat. I just want to say thank you for having me here to share this information. I'm not sure if we have any questions that may come up, but once again, I just want to say thank you, and I hope this information was helpful.
Thank you. Thank you so much, Melissa. That was a lot of great information. I also want to point out, if anyone's interested in these services, of course, you can reach out to Melissa. But if you already have a provider, speak to your providers. Your healthcare really should be a conversation. It should not be a monologue, is what I always like to say. And then on top of that, I love that you have that program. But for people who are undocumented or other people who cannot afford healthcare, there's also NYC Care, which is just for city residents that you can also go and apply for that. So, which is to go to our public hospitals and receive care there. One thing I wanted to speak more about was the PrEP. So I used to be a sexual health educator, and PrEP and PEP, I think, is really something that a lot of people don't know about, right? So, PrEP, as you said, is pre-exposure. So this is before you get exposed to HIV, you can take this. And there's a lot of really interesting and cool stuff that's happening. We have 2 daily pills, and now we have an injectable, right? So you can either take a daily pill, so 1 pill a day, and it can protect you up to 99% from contracting HIV, or you could take it which we call on demand, which is you take 2 pills 2 to 24 hours before having intercourse, 1 pill the day after, and then 1 pill 4 to 8 hours after. And that also shows to be efficacious. And then we have the injectable, where you get the injectable once a month for 2 months in a row, and then every 2 months. And that also is really shows to, I believe it's 98 or 99% effective. So there's a lot of stuff that's going on in this world that, no longer should we be scared to talk about these things. No longer should we worry about all this stuff. The one I wanted to answer the best self question. I think for me, wearing like any sort of like athletic wear, because that means that I exercised for the day and I feel good about taking care of the health in all aspects, in all holistic holistic view of health. I want to go to your one point about asking questions. When I was a case manager, one of the things I used to say is bring a list of questions, right? Because sometimes you get caught up in your appointment, and you're like, oh man, they're talking so much, they're saying all these things, and then you forget what you're doing. Off the top of your head, do you have anything that you're like, I would keep this on my list of questions when I go in to see a provider?
I find, for me personally, one question that I tend to ask, whether I'm seeing the eye doctor, whether I'm at, my primary care physician, is there anything that I could be maybe doing better to take care of my health, right? Like just plainly. And that can be a lot, right? Like, I mean, I know personally self-care, I mean, I want to journal every 5 minutes to make sure that I'm okay and I'm not like losing my mind. But, my healthcare provider may say, oh, well, initially just like making sure that you're staying hydrated, or, if there's particular vitamins that I'm taking that I'm not being consistent with, right? Like, have you been consistent and making sure that you're, creating that routine to make sure you're getting those vitamins in? So, I mean, I think just like the baseline, like what do you feel I could be doing better? What can I do to make sure I'm my healthiest? So
Yeah, I love that. And also just like seeing, I think sometimes we think of healthcare and self-care as separate, but
mhm.
like going to a physical or to a preventative appointment is self-care, right? If we are making sure that we stay healthy, right? The doctor, as you were saying, the doctor should not be a place where, you know, oh, I'm sick, let me go to the doctor. It should just be like, no, I'm gonna make sure that I stay good, right? I'm gonna stay healthy. I'm gonna stay what I'm doing. Um, I love that. So we have 1 minute. What is one major takeaway that, if we didn't learn anything today from Melissa Centellis, what is this one thing that we need to know?
um Having conversations like this, it's super important. And I think in terms of removing stigma and normalizing, I mean, of course, talking about sexual health, but health overall, it's a constant conversation. Like you said,
Mhm.
right? Self-care and taking care of our physical health, like these are two things that intersect. And so I'm hoping that folks can leave here just knowing, it's Wellness Wednesdays. Let's make sure we're having these conversations, and maybe just mentioning the workshop to a friend or a family member or a peer,
Mhm.
and just having those conversations.
Awesome. So I want to thank you, Melissa, for joining us and giving us all that great information. And I want to thank everyone for joining in today and coming to Wellness Wednesdays. We hope you have a great rest of your day and week, and we'll see you at the next program. Bye.